everyone. Myself Shubha. In this video, you are going to discuss with important questions to your examinations. So, in this video, you are going to discuss regarding which are the important questions and what are the syllabus and how you have to write the exams. So, the first thing is first you have to know what is community health nursing, right? So, what do you mean by community health nursing? Ma'am, change PPT. Okay, first is what is community health nursing? So, community health nursing is a subject in the third year of GNM nursing. So, CHN is a nursing specialist that focus on improving the health of community by delivering health services. So, why the community health nursing syllabus is included for nursing students? Because after you are becoming a nurses, so you have one specialty community health nurse. So, if you are going to become a community health nurse, you should deliver some of the services by going to the community. So the next thing is coming to the syllabus. So what are is the unit? What are the syllabus included in community health nursing subject? So the unit one. In unit one, the health system in India. So in the unit first, there is the discussion of health system. So we have three health system. So in state level, central levels. Okay, so you should know how the health services is going to deliver according to the state and according to the central level. So in central level there is different type of programs, and in state levels there will be the different level of programs. For example, WHO. So the WHO is a central. Okay, so according to that you are going to study in unit 1, health system in India. So coming to the unit 2 is healthcare delivery system, and unit 3, health planning in India. So our government is going to plan how the health should be delivered. So it should be delivered for both rich peoples also and both for poor peoples also, because nowadays the more health problems is going to suffered by poor peoples. For example, malnutrition because of the in economic. So they are going to suffer by malnutrition, everything. So according to that, the government should plan the health, so that you are going to discuss in the health planning in India, that is unit 3. And coming to the next one, unit 4. In unit 4, the specialized community health services and nurses role. Means after the nurse is going to become a community nurse, what are the services she need to provide to the community? What are the health care she need to provide? What are the services she need to give for the village peoples? That you are going to study in the unit 4, that is nurse's role as a community health nurse. And coming to the next, unit 5. So in unit 5, we are going to study the chapter national health problems. So in our country, there are so many health problems, like we have tuberculosis and malaria, typhoid, dengue. So many health problems is there, like communicable diseases are there, non-communicable diseases are there. So in this unit, you are going to study which are the national health problems and how to prevent that, how to manage that, everything you are going to study in the unit 5. And unit 6, so national health programs. In unit 5 we discuss what are the problems will arise in national or in our country. But in unit 6 we are going to study regarding how to control, which are the programs given by the government to control the problems. Okay, so in unit 5, you are going to study only what are the problems present in our country. And in unit 6, you are going to study regarding what are the programs given by the government to reduce the health problems. And coming to the unit 7, in unit 7, you are going to study regarding demography and family welfare. Family means, so family welfare means we have to increase the population, and sometimes we have to decrease the population. You all know, if the population is increases, there is the chance of unemployment, poverty, so many problems will arises to our country. So if there is no population, then also it will be a problem. So it should be managed in proper ratio. So because of that, you have to give some idea regarding family planning methods. So the community peoples don't know what are the family planning methods, how to adopt them. So you have to give them idea regarding family planning. So in unit 7, you are going to study what is the family planning methods, how we can encourage the families, how we can make the family good conditions. So these all the things you are going to study in unit 7. And coming to the next, unit 8, health team. Health team means, in health team so many peoples will come. For example, doctors, nurses, pharmacologists. Okay, so many peoples are going to work as a team. So only one, like for example, only doctor cannot provide the treatment. He need the help of the nurse also, and nurse need the help of pharmacologist. So when it is formed as a group, they can provide a good health to the community peoples. So in the chapter or in the unit 8, you are going to study about what is health team, what is the purpose of health team, who all comes under in the health team, and what are their roles. For example, in health team, the doctors means, what are the doctors role, what is the nurse role, what is the pharmacologist role, what is the anesthesiologist role. These are the things you are going to study in unit 8, that is health team. And coming to the next unit is unit 9, health information systems. Nowadays everything is updating, like before and all we are not seeing any computer systems or anything in the hospital. But nowadays if you go any hospital, we can see the computer in the nurses station. We are getting information by the doctor through computer. We are sending emails, we are receiving medicines, everything we are going to do in the systems like computer we are using nowadays. So you are going to study what are the information given by the government, how to deal with that. And the last unit is unit 10, that is health agencies. So what are the agencies? In agencies there is voluntary agencies, and another one is involuntary agency. You know the meaning of voluntary. Voluntary means the peoples are interested and they only join that agencies. But involuntary agencies means it will be given by the government. Voluntary agencies means if you are interested, you can also join the team and you can also help the society. But involuntary agency you cannot join the it should be governed by the government. So in health agencies you are going to study regarding voluntary and involuntary agency. So in your syllabus there are total 10 units. Okay, so in 10 units you have to write the exam for 100 marks. Right, in 100 marks the writing marks is for 75 marks, and 25 marks is for internals. Okay, so total marks will be 100 marks, written 75 marks, and internals will be 25 marks. Okay, coming to the next, let us discuss which are the important questions for your examinations. So these are the questions which may be asked in your exams, because if you are taking previous year questions papers, you can see these questions. Mostly they will ask these questions. So we are going to discuss what are the important questions. So before that, let us tell what is the question paper pattern. Okay, I told you have to write the exam for 75 marks. So you should know what is the pattern of exam, right? So if you are taking your question paper, first they will ask short answer. Okay, short answer means you should write only the meaning, one line or two line, not more than two to three lines. In one meaning only you should give the answer, and it will carry 1 mark for each questions. And next they will ask true or false questions. There will be one statement. Okay, so for that statement you have to mark true or false, and each question carries 1 mark. So there will be one statement. They will ask whether it is a true or false. You should mark only true. If the statement is false, you need to mark false. So each question carries one mark. And next will be short note. So short note each carry 4 to 5 marks, and in this you should write detail. Okay, so because short notes means they will ask for usually 5 marks and 4 marks. So your answer should be more than 3 to 4 page. Some students will be there, they will write only 1 page, 2 page, and they will ask only given 2 marks, 3 marks. If you want 4 to 5 marks, then your answer should more than 3 to 4 pages, then only you will get the full marks. So your answer should be written detailedly, and mainly they ask programs which are conducted in the community. Okay, so in short notes they will ask mainly programs. For example, national mental health program, national nutritional program, midday meal program. So in community health nursing subject you are going to study more programs, right? So these programs only they will ask mainly for short notes. So mainly focus on the programs. Okay, next pattern is long essay. So the long essay will carries 8 to 10 marks. So you should write minimum 4 to 5 pages. So and 4 questions write detailedly. So for long questions, you should write detailed answer, and in long essay, they will ask 4 questions, and each will carry 8 to 10 marks, and your answer should be more than 4 to 5 pages. Okay. Next one is fill in the blanks. So fill in the blanks means you should, they will be missing one word. You should write the word. So each question will carry 1 mark. Here, no need of writing long essay type answer. Only you should write the word type answers. So there will be 4 questions in the fill in the blanks. Each questions will carry one mark. So you can get easily 4 marks in fill in the blanks. So next coming to the important questions. So according to your unit, which are the important questions they may ask, I am going to tell in this video. And if possible, please note down the questions. Okay. So in unit 1, the Director General of Health Services and State Ministry of Health. So this question you can expect from unit 1. So it is the most important questions. If you see previous questions, this question will be asked like more times. So coming to the next unit 2, the indigenous system of medicines. Means indigenous system is nothing but it includes Ayurveda, Yoga, Unani, and homeopathy. So in this they may ask what is Ayurveda, and write about yoga, write about homeopathy, which are the medicines you are going to use, what is the treatment given in Ayurveda, what is the nurse role, what is the doctor role. This they may be asked in unit 2. So these are the important questions. Please make note down. Unit 1 and Unit 2. The important questions are. And next, coming to the Unit 3. Sorry, in Unit 2. So after endogenous system of medicine, they may be asked both long answer and short answer question will be asked. In Unit 2 you can expect both long answer and short answer, but in Unit 1 you can expect only long answer question, that is for 10 marks. In Unit 1 there is no short answer question, but Unit 2 there will be both long answer and short answer questions, and they may be asked voluntary health agencies. So there are so many programs will included in voluntary health agencies, that is for 10 marks. So give importance while studying or while preparing for your exam. Please give importance for studying all programs which comes under voluntary health agencies, because definitely one program will be asked for 10 marks in the voluntary health agencies, that is in Unit 2. And I told both short answer question and long answer question. So in long answer you may expect question from voluntary health agencies, right? So in short answer question you may expect the questions like WHO. They will ask define WHO or purpose of WHO, or define what is the meaning, definition. Next one, UNICEF. They may ask define UNICEF, or what is the function of UNICEF. Then the third one is Central Social Welfare Board. They may ask what is the meaning of Central Social Welfare Board. And the next one is National Health Programs. They may ask when it started, and who is under this, which government introduced, in which day, what is the function or what is the role. Okay, so or they will ask definition of National Health Program. So these are the questions they may ask for short answers. And coming to the Unit 3, National Health Planning. So in Unit 3 you may expect the question National Health Plannings. So health committees and national health policies. So in Unit 3 you can see these questions. Health committee, who all comes under health committee, what is committee, why they are doing as a committee, everything you need to write in health committee. And if they are asking national health planning, you should write according to how the health is planned. Like yearly the plan will be changed. There will be 5-year plans, right? Everyone know regarding 5-year plans. Every year the planning will be changed according to the budget. So everything you should know. And if they ask regarding national health planning, you have to write all 5-year plans. And coming to the next unit 4, reproductive child health. In reproductive child health means it will focus on both mother health and both child health also. So the next question is school school health services. So you know school health services, so many services is given by the government for especially school childrens, because some childrens are not going school properly. To attract the childrens for coming school, they made so many services, they made so many programs to attract the childrens, which include. Shafina, please unmute him. Shafina, can you please mute? Okay, thank you. School health services includes midday meal program, and you know about midday meal program. Okay, so they may ask for short essay, 4 marks or 5 marks question. You should write what is the meaning of midday meal program, when it started, what is the purpose, what is the advantages for school children, what is the role of nurse, everything you should write in midday meal program, so you can gain easily 5 marks. And next one is prevention of communicable disease. So you all know the meaning of communicable and non-communicable disease. Communicable means the disease which will spread from one person to another. So in nowadays in our society there is the more chances of communicable disease, that is also especially in the village side. Okay, so they are not maintaining hygiene, they are not using safety precautions. So as a nurse you have to know what are the precaution method for preventing communicable disease. You all know as a nurse you should practice hand washing, right? Why you are maintaining hand washing? Because to prevent the infections. So the village peoples don't know what is the importance of hand hygiene. So as a nurse you should teach them, or you should know about how to prevent the communicable diseases. And the next one is occupational health nursing. So nowadays for the occupational health nurse it is a wide opportunity to get a job in occupational health nurse, because in every factory industries, so they are going to recruit the occupational health nurse. So you should know as a occupational health nurse what is the role of nurse, what are the duties carried by occupational health nurses, what is the purpose, what is the advantages, what is the nurse's role. So here you are going to give the first aid treatment for the peoples who are getting fractured or injury while in the occupations. So there are so many factories, so many industries, so many people are working, and so they may suddenly get injuries or fractures or emergency. So during the time you need to give the emergency services in the occupation people. So the next question they may ask, what is communicable and non-communicable disease? Or they may ask what is the difference between communicable and non-communicable disease. So communicable means, so you write the meaning first, communicable, and again you should write the meaning of non-communicable disease and give some example for communicable disease and give some example for non-communicable disease. And you write what are the prevention of communicable, what is the prevention of non-communicable, and what is the role of role of nurse in communicable disease, and what is the role of nurse in non-communicable disease. You can easily write the difference between communicable and non-communicable disease, and you can easily get 5 marks by this attending these questions. And the next one is geriatric nursing. So you all know what is the meaning of geriatric. Geriatric is nothing but old age peoples. Okay, in geriatric nursing you are going to ask what is arthritis, or so many health problems will be there for old age peoples, like night blindness, osteoarthritis will be there, so many mental disorders will be there. So in geriatric nursing they will ask for short answer like 1 mark or 2 marks. They will ask what is arthritis or what is schizophrenia, like these questions you can expect from the geriatric nursing. So these are the important questions which will be asked in the unit 4. One is school health service, midday meal program, prevention of communicable disease, occupational health nursing, communicable and non communicable disease, and the last one is for short answer, that is geriatric nursing. And the next unit 5. So in unit 5 the question may ask vitamin deficiencies. So there are so many vitamins you are going to study. So vitamin A deficiency, vitamin B deficiency, vitamin C deficiency, vitamin D deficiency. These all the vitamins, and you should know what are the diseases will arises because of the deficiency of vitamins. All vitamins you should know what are the diseases it is going to cause. So you can write what is malnutrition. So the question may ask what is malnutrition. So you should write introduction, and you should write what is malnutrition, how you can prevent, how you can manage, and what is the role of nurse in the malnutrition. And you should write what are the symptoms also. So in malnutrition they may ask kwashiorkor. So it is also one type of protein energy malnutrition. So due to deficiency of protein, it is going to leads to kwashiorkor and marasmus. So the question may ask in unit 5 is malnutrition, kwashiorkor, marasmus, and all vitamin deficiency. You should read all vitamins, vitamin A, B, C, every vitamins you should know the deficiencies. And coming to the next, unit 6. So in unit 6, you are the question may ask national TB control program. TB means tuberculosis. So how you are going to control the tuberculosis? So you all know tuberculosis is a very dangerous disorder. If it arises for one person, it will easily spread to another, and it may cause death of the patient also. So it is a very dangerous disease. So you have to prevent tuberculosis. So what are the precautions you are going to take to prevent? What is the prevention methods you are using? What is the role of nurse, and what is the treatment, and what are the services or what is the program given by government? Now government given free cost treatment for tuberculosis patient in the government hospital. But peoples will don't know regarding this. They will have fear, like if they get any tuberculosis, they will not go for hospital because they are thinking about money. But you should teach them regarding the government services. For teaching others, first you need to know, right? So in national tuberculosis control program you should study regarding what are the services given by the government. And the next one is AIDS control programs. Everyone know regarding AIDS, how it is going to spread, what are the routes, what are the medications, everything. So the AIDS control programs, what is the services by the government, what are the fund given by the government, and what is the role of nurse, how should prevent the AIDS, everything you should know in AIDS control programs. So in unit 6 they will ask national TB control program, AIDS control program, and these are the programs which is implemented by WHO. Okay, in unit 6 you are going to study how the TB control program and AIDS control program, right? So these two programs also implemented by the WHO, World Health Organization. And in unit 7, in unit 7 you are going to, you are going to face the question like what is demography. If they ask what is demography, you need to write introduction, and what is the plan, what is the government services, infrastructure, everything you should write in demography. And they will ask family planning methods. So family planning methods they ask for long essay also and short essay also. Family planning methods they may ask for 10 marks, or maybe sometimes they will ask for 5 marks. So if they ask family planning methods, you need to write what is the meaning of family planning method and which are the method used. Like for example, copper T, vasectomy, tubectomy. These are the methods which are used in the family planning method. So if you are writing what is vasectomy, you should write what is the purpose of vasectomy, and tubectomy, what is the purpose of tubectomy, and oral contraceptives. So what is the uses of oral contraceptives? So copper T, what is the uses of copper T? Everything you should write in the family planning method question, and you can get 10 marks or 5 marks. And the next question is health team. So as I said early, health team means so many people are going to work in the health teams. Asha workers, nurses, doctors, pharmacologists, so many people are going to work. So as a Asha worker, what is the role of Asha worker? You should know. They may ask in health team question, what is the role of Asha worker? What is the role of nurse? What is the role of doctor? What is the role of pharmacologist? They may ask questions like the health team. In health team, the members who are going to join. So based on that, the question may arises from unit 7. And the last question, the role of nurse in various sector. So you all know, as a nurse you can work in so many sectors. You can work in community, you can work in hospital, you can work in teaching sites, you can work in occupational health nurse, right? So there are so many sectors to work for the nurses. So as a nurse, what is the role of her? If she is working in community, what is the, sorry, if she is working as a community health nurse, what is the role of community health nurse? What is the role of hospital nurse? Everything you should know in role of nurse in various sector. And the next unit 9, so vital statistics. So this is the important questions. So vital statistics, the question may ask, you should write every year's what is the statistics, how many birth rate, how many death rate, what is morbidity rate, what is mortality rate, everything you should write in vital statistics questions. And the next question they may ask, health records and its importance. So it is very important to maintain a health records. So it is it involves birth records, and it involves death records. And so if any pregnancy lady, that also should maintain in the records. It is very much important to maintain the document and records. So in health records you are going to write what is the type of records, what are the uses of records, how to manage that, everything you should write in health record. And they may ask what is the importance of records. So if they ask what is the importance of records, you should write records are important for maintain confidentiality, or if any cases, any problem arises, if you have record, you can manage with that. So these are the long essay question asked by unit 9, vital statistics and the importance of health records. And for short answer they may ask what is morbidity rate and what is mortality rate. You all know mortality means death rate. So they may ask for 1 marks. You should write one line answer. What is mortality? What is morbidity? It is very important questions. If in both morbidity and mortality, definitely one question will be asked for 1 marks. So if you are studying these important questions, definitely it will help you to pass in your examination. So in this video, what the questions I discussed, these questions are very much important for your examinations. So while you are starting preparation for your exam, you should start by, like, you should have one blueprint. According to the blueprint you will get to know how many marks will be asked by unit 1 or unit 2. So according to that you can study, and you should know which are the important questions. And main thing, you should know how to write the exams. If they ask Short answer questions, no need of writing 2 to 3 line answers, because it is very important to save the time in your exams. So if they ask short answer, write the answer in 1 line. If they ask short essay, write 2 to 3 pages. And if they ask for long essay, that is for 10 marks, so you should write 4 to 5 pages. And true or false, just you need to write whether the statement is true or whether the statement is false. That is enough. And in filling the blanks, they will given one statement. In one statement, one word will be missing, so that word you should be matched. That is in the fill in the blanks. So this is the thing you should keep in your mind while writing your exam. So the time management is very much important for your exams. Okay, so if you have any doubt, you can clarify. If you have any doubt, please ask me. I will clarify your doubt.
Ma'am, please one more explain because I am joining. Good evening, ma'am.
Good evening.
Ma'am, please one more explain because now I am joining.
From starting, you are not present.
Yes, ma'am.
Okay, you know the syllabus, right?
Yeah, yes, ma'am.
There are 10 units in community health nursing. First thing, you need to know what is community health nursing. So community
Yeah.
health nursing means it will focus on the services which is going to provided by the community health nurse. So in community health nursing there are 10 units. So in unit 1 is health system in India. So we have central system, state level. You know, central hospital also is there, and government hospital also is there. So in central hospitals the service is different, and in government hospital the service is different. So in unit 1 you should study regarding what are the services given in central hospital, what
Central
are the
hospital and
services
government.
given in government hospitals. And coming to the unit 2, you need to study about healthcare delivery system. And unit 3, health planning. So there are 5 years planning, so you should know regarding full 5 year plans in unit 3. And unit 4, community health services and nurses role. As a nurse, what is
Sudha ma'am,
ma'am.
am I audible?
Yes ma'am.
The recorded classes is available in our Nursing Guru YouTube channel. Okay. Okay. Now it's time for discussion. If you anyone have any doubt, you can discuss now. Clarify it.
If you have any doubt,
No, ma'am.
Hi students, good evening.
Good evening, ma'am.
Okay, I hope all are GNM third year students and you are waiting for your exam, is it? Mostly your
Yes,
exam will
ma'am.
be conducted in December itself. So you have two different exams are there, both the theory and the practical. In theory examination, you have OBG nursing and community health nursing. For OBG nursing, the last day we conducted one live class. I hope all are joined with that. It was useful. Then the second class regarding community health nursing will be conducted here. So this is the time for discussion. You can use this chance to clarify your doubts. Okay. So, however, the recorded classes will be available in our Nursing Guru official YouTube channel. Okay, so but and also additionally as per the students request before your exam date, mostly that is 7/12/2024, December 7th, we are planning to conduct one live class. So in that live class, it will be we are planning to host more than 1 hour. So complete discussion about OBG nursing and community health nursing will be available there, and also regarding a discussion to how to write exam as well, theory examination and as well as practical examination will be available. Okay, that is on December 7th. So don't forget to join that classes. I hope definitely that will be useful. It will be conducted by different two teachers.
Okay, ma'am.
Okay, and I think you have some doubts regarding today's session and also regarding the examination and evaluation criterias, and also how to do the practical examination. Anything you have means you can write it in the comment box or otherwise chat box. Otherwise, you can ask now. And also, the nursing related notes, question paper, and sample question bank are available in our Nursing Guru application. You can download from the Google Play Store. It will be available for 6 months for just 999 rupees. Okay, and also for the notification and offers or important updates, any changes in the timetable, like that will be updated through the Instagram page or otherwise YouTube channel. Everything named as Nursing Guru Official, so you can check with that. And also in the chat box session, I attached one link that is our YouTube channel link. Their community health nursing recorded video class is available. And 2024, this January 1 exam was conducted. 2024 examination question paper discussion is available, and we prepared a video, and it will be published on this Saturday. So Saturday evening, mostly 6 o'clock, it will be updated in our YouTube channel and also as well as in our Nursing Guru application. It will be available, and all video classes for free. So you can just check that one. And any doubt, you can contact with us. Okay. Ma'am, please tell about maternal health care, and it's coming on 9 mark. Okay. Maternal health care, are you talking about the essay question?
Hello.
Okay, there one doubt is there, Shubha ma'am. Please tell about the maternal health care, and it's
Met-
coming
uh,
for 9 marks. I
yes.
think they're asking about essay question.
Okay, ma'am. See, in maternal health care, you should write both regarding mother also and for children's also. So, what is the care given for pregnancy women, and what is the care given for the newborn babies, and what is the care given for children's. So, there are so many services given by the government. So, that is the maternal health services. So, by the government, the pregnant woman is getting food, nutritional food, and folic acid tablets, so that the you should write regarding what are the services given by the government for the pregnancy mother and for the children. So as I said, like reproductive child health programs. Okay, so what is the services like folic acid tablet supplementation and good nutritional food? Regarding this, you should write in maternal health services. So maternal health services is nothing but both mother and children's. Clear?
Hope it is clear. Anyone have any other doubt? Just you can write as like in call message or you can raise your hand. Okay, I think Jibin Thomas, Bhagyasri Sneha, Shilpa Pandya. You can ask your doubts now. How was your second year and your first year examinations? Okay, Sneha, you can ask your doubt.
Ma'am, can you please explain about the permanent method of family planning?
Okay, so in permanent family planning methods, there are two types. One is vasectomy and another one is tubectomy. So vasectomy means it is defined as cutting of vasa deferens. So it is done for female patients, and tubectomy is made for male patients. So it is the permanent sterilization method. So once the couples is undergoing permanent method of family planning, again there is no chance of getting pregnant. If they are going for temporary family planning method, for example condom, oral contraception, copper T, there is a chance to get pregnant after stoppage of using the contraceptive methods. But if they are undergoing permanent method, then it cannot be possible after once undergoing for family planning, permanent family planning. In permanent family planning, they may ask what is tubectomy and what is vasectomy. Tubectomy means cutting the fallopian tubes and vasectomy means cutting vasa deferens. Clear?
Yes, ma'am.
Yes, ma'am.
Another doubt is also common.
Okay, one more doubt. I think it is there. National health agencies. Regarding national health agencies.
Okay.
Shobu.
In national health agencies, there are two types of agency. One is voluntary health agency and another one is involuntary health agencies. Voluntary health agencies means like there are so many programs which are voluntarily made. So for example, midday meal programs, RCH, reproductive child health programs. So there are so many programs which are made voluntarily, and there are so many programs which are made involuntary. Involuntary means like example WHO, so World Health Organization, this is a involuntary health program. So these programs are given by government itself, we can't change that. Voluntary program means it can be changed by ourselves, but the involuntary agency means the peoples cannot join to that program or it cannot be changed. It is initiated by the government itself. If any changes, it should be made by the government. So it is very important for long essay. In voluntary health agencies or in involuntary health agencies, they may ask one program. Clear?
Okay, hope it is clear. And also, when you are studying about the health agencies, don't forget to study to learn national health agencies and also international health agencies. For the question specifically for 4 markers, so national health agencies, maybe the Indian Red Cross Society is one of the important question you may be get for your examination. So when you are learning, don't forget to learn these things and also ask like Shubha ma'am said, the voluntary and involuntary organizations. Okay, hope it is clear. Any doubt, you can just message here.
Excuse me, ma'am.
Yes, please.
Can you explain about Niti Aayog?
Yes. For the if we are going to explain about each and everything specifically, it will take a long time because we have a limitation. We need to wind up this session at 6:30. So actually, it is 26. So regarding the complete note means exam-based short notes are available inside Nursing Guru application. You can just visit that one and check with that. Definitely, you can learn very easily.
And in this video we are just discussing what are the important questions, and if you need regarding details we will make the next video. In that I will describe every each and questions. I think good.
Excuse me, ma'am.
Yes, please.
Ma'am, is there any differentiation between healthcare agencies and organization?
No, it is same. They may ask voluntary agencies or they may ask voluntary organization. Both are same. Agency also same, organization also same.
Okay, ma'am.
Any more doubts?
Okay, one more doubt I saw that one small family norms. Okay, as I said earlier, if we are going to clarify each and every doubts means it won't be end. So that's the reason just to check with the nursing Guru application and the complete notes and study material, question bank, question papers are available. So you will get an idea about how to write, and you can also get an idea how an examiner will be expect something from your question or answer sheet. So same like the method you can implement in your exam in your answer sheet. So that is the reason you just check with the question bank also. Okay, so regarding the writing examination, the method of writing examination or anything like a hall ticket or any basic awareness, if you need you can just ask now. Regarding practical examination, anyone have any doubt?
Excuse me, ma'am.
Practical examination, okay, okay, please, please.
Good evening, ma'am.
Good evening.
Ma'am, can you explain NITI Aayog? Actually, it is important question for us. So can you please explain?
Could you please repeat the question, or otherwise can you write it in this box?
Yeah, sure, I will write.
Okay, 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 because the voice is little blunt. Any other? Okay, so one more revision class is available for the GNM third year students, and that is in 2024. Before this December, that may be the last class for the GNM third year students. But post BSc, BSc students, they have the live classes daily. They have the live classes that is completely for free. So if you have any friends who are studying BSc nursing or post BSc nursing, just share these details with them. That is completely for free, so it may be useful for them. Okay. And also the next revision class for the GNM students will be held on 7 December 2024, community health nursing and OBG nursing, and also regarding the practical examination explanation is there, and that is the that may be definitely that will be help you in your examination. So don't forget to join that day. And also pre-registration link is available in our Instagram page bio. It will be attached. So just pre-register. So it is easy to share the link with you. I hope it is clear for everyone. Now it's the time for wind up. It is 6:30. So anything is there, definitely we can meet you on next class.
Yeah, now it's time to wind up. Thank you once again for your time and effort, and wishing you all the very best in your studies and practice. Thank you. Now it's time to leave.
Good evening, and madam. Thanks, and madam.